Welcome to our online facilitation learning session. We are on week 5 of this course, NSC 303. And today we'll be discussing Unit 5, topic Health Resources, Monitoring and Evaluation of Health Services. But for today, we'll only be covering healthcare resources and monitoring. For today, the next class session will look at the evaluation of health services. Because the topic is a bit broad, I do not want to bombard the learners with so much information at once. So I've decided to divide Unit 5 into 2. So today we are looking at Part A, which is healthcare resources and monitoring alone. And so we have the learning goal for this Unit 5 Part A, which are at the end of today's facilitation, learners should be able to learners should be able to describe the measures to develop human resources for health, explain ways of ensuring community involvement to be adopted by the Ministry of Health, describe the whole scope of health manpower, including intermediate agencies engaged in the delivery of national health care services. And lastly, learners should be able to explain the action required to develop monitoring and evaluation process as part of managerial process for national health development. Resources are needed to meet the many health needs of a community. No nation, however rich, has enough resources to meet all the needs or all aspects of healthcare of its citizens. Therefore, an assessment of the available resources, their proper allocation, and efficient utilization are important considerations for providing efficient healthcare services. These basic resources for providing healthcare are 1. Man, money, and material, which you will learn in the following broad categories as we go along in this discussion. That is the human resources and money and material resources. Let's begin by unpacking what we mean by human resources. Human resources development. This strategy seeks to involve not only the health personnel, but also many other personnel from various sectors as human resources. Primary health care has to mobilize human potential of the entire community. This is possible on the condition that individuals and families accept greater responsibility for their own health. People need to be involved in deciding on the health system required by them and the health technology acceptable to them in delivering a part of national health program. This is to be achieved through self-care and family care involvement in joint action for health. Health manpower constitutes a major part in human resources. Strategy and definition. The term health manpower includes both professional, that is, doctors and nurses. We know that the nurses and the doctors are professional, as well as auxiliary health personnel. And who are the auxiliary? We know them. So we see that the health manpower constitute both the professionals and the auxiliary, who are needed to provide this group of health manpower, that is the professionals and the non-professionals, are needed to provide the health care. An auxiliary is simply defined by WHO as technical worker in a certain field with less than full professional training. The health manpower requirements of a country are based on the following. 1. Health needs and demands of the populations. What do we mean by health needs and demands of the populations? It simply means the health needs in turn are based on the health situation and health problems and aspirations of the people. Secondly, desire outputs. That is, you want to prevent disease, you want to promote good health, you want to cure disease, you want to rehabilitate as well as control or eradication of infections. Sector-wise distribution. What do we mean by sector-wise distribution? The healthcare system is intended to deliver the healthcare services. It constitutes the management sector and involves organizational matters. It operates in the context of the socio-economic and political framework of the country. In Nigeria, for example, it is represented by major sectors or agencies which differ from each other by the health technology applied and by the source of funds for operation. We are looking at the different sectors now that we have in Nigeria and their distribution. We have the public sector, we have the private sector, we have the ingenious system of medicine, we also have the voluntary health agency, as well as non-governmental agency. We are going to unpack each of these sectors. 1. Public sector. The public sectors comprise of the primary health centers, hospitals or health centers, specialist hospital, teaching hospitals, as well as health insurance schemes. These are the three main public sectors that we have or we operate in the context of Nigeria. Then we look at the private sectors. The private sectors includes private hospitals, polytechnics, nursing homes, and dispensaries, as well as general practitioners and clinic. Indigenous system of medicine, that is homeopathy, are unregistered practitioners, that is the natural party. The herbal medicine practitioners, voluntary health agency, and non-governmental organizations are Nigeria Red Cross Society, Planned Parenthood Federation of Nigeria, the Leprosy Mission Nigeria. Professional bodies: the Nigerian Medical Association, National Association of Nigerian Nurses and Midwives, Pharmaceutical Society of Nigeria, National Association of Physiotherapists, Health Record Registration Board, Medical and Health Workers Union, missionary bodies, Christian Health Association of Nigeria, Islamic Organization, and lastly, international agency, which are the WHO, the UNICEF, the UNDP, UNFPA, USAID, Site Savers International Society for Family Health, known as SFH. Rural-urban distribution. What do we mean by rural-urban? So we just unpack the different sectors distribution. Rural-urban distribution. Geographically, as we have seen, that the sector distribution does not give the real picture of available manpower in the area. When we analyze them between rural and urban area, the distribution of manpower is not clearly seen. We can observe the gross maldistribution of health manpower. Studies in Nigeria have shown that there is a concentration of doctors and nurses up to 80% in urban areas, where only 20% of population live. This maldistribution is chiefly attributed to the following: absence of amenities, that is the social amenities in rural areas, lack of job satisfaction, professional isolation, lack of rural experience, and inability to adjust to rural life by the professional doctors and nurses. Planning and ratio in relation to population. Health manpower planning is an important aspect of community health planning. It is based on series of accepted ratios such as doctor population ratio, nurse population ratio, as well as bed population ratio. International action and the role of WHO. International action will include the following. 1. Information will be collected and used internationally by the WHO regarding people and groups throughout the world who could provide individual or group support to countries on various aspects of their strategies. UNESCO, in its worldwide literacy program, will be requested to use health information with a view to providing basic understanding of nutritional and health needs and prevention and control of common health problems. WHO will engage in technical cooperation with its member states and promote such cooperation among them to ensure the minimum mobilization and development of personnel for health. WHO will as well ensure the involvement of other United Nations organizations like UNDP, UNFPA, international non-governmental and voluntary organizations, by identifying specific tasks in which they can engage. We promote diagnosis between developing and developed countries to prevent brain drain of health personnel. Financial and material resources. Now we want to look at what do we mean by financial and material resources. Financial and material resources are as essential as human resources for the successful implementation of the strategy. It involves efficient use of existing resources and making provision for the additional resources. Below is the National Health Development Plans in Nigeria. The first National Health Development Plan was between year 1946 to 1956, which was 10 years plan, followed by 5 years plan, which occurred between 1970 to 1974. And the next one we had in Nigeria was for 6 years, which was between 1975 to 1980. And the last updated one that we had, the last plan we had in Nigeria was in 1988 up to date. So far it has not been reviewed. We're still using National Health Development Plan of 1988. Imagine. Financial resources and gross national product, that is GNP. Money is an important resource for providing health services. No one can dispute that. Scarcity of money affects all aspects of health delivery system. In most developed countries, government expenditure for health lies between 6 to 12% of GNP. In developing countries, it is less than 1% of the GNP, and it seldom exceeds 2% of the GNP. To achieve health for all, WHO then has set a goal: the expenditure of 5% of each country's GNP on health care. So we've seen that the World Health Organization understood that for any country to achieve health for all, our GNP must be at 5%. But as we go on in this study, we'll see what Nigeria GNP is. Unfortunately, at present, Nigeria is spending about 3% of GNP on health and family welfare. So we've seen that the goal of health for all, we are not achieving it yet. And the factor or the reason can be attributed to partly our GNP. Because if the World Health Organization present to us 5% and we are still on 3%, we see that our citizens have not yet all achieved health for all. In Nigeria, 20% of the nation's budget is to be expended on health. The per capita health expenditure is not more than 10 to 15 dollars. This is far less compared with Jamaica, which expends $100, as well as United States of America, which expenditure is 4,000. We can see that the difference is huge. It's wide. This accounts for the drop in the life expectancy, which is about 52 years. The greater part of the health expenditure goes to primary health care. Infant mortality rate in Nigeria is about 80 to 1,000. Child mortality rate is about 28.8 to 1,000. on the average, both urban and rural populations, and maternal mortality rate is about 4 to 1,000. So the federal government has also directed that 12% of the state budget should go for health. Priority in financial allocation. Since money and material are always scarce resources, they must be put to the most effective use with an eye for maximum output of results on minimal investment. Since deaths from preventable diseases such as malaria, whooping cough, measles, tuberculosis, tetanus, diphtheria, malnutrition frequently occur in developing countries, the case is strong for investing resources on preventing these diseases. Spending money on multiplying prestigious medical institutions and other high-cost medical establishments which cater for a small percentage of the sick citizens absorbed a large portion of the national health budget. Management techniques such as cost effectiveness and cost benefit analysis are now being used for allocation of resources in the field of community health. Review distribution and reallocation of health budget. Review of allocation of health budget to primary health care at peripheral, intermediate, and central level in urban and rural areas, and to specific underserved groups. Reallocation of existing resources or any additional resources for providing primary health care to underserved population groups. Analysis of the needs in terms of cost and material for appropriate health technology and establishment of health infrastructure. Consideration of cost effectiveness of different technologies of various health programs to find alternative ways of organizing the health system in relation to the cost. Estimates the financial needs and secure additional funds. Estimation of the magnitude of total financial and material needs to implement the strategy. Consideration of alternative ways of financing the health system, including the possible use of social security funds, e.g., ESI, CGHS, identifying activities that might attract external grants or loans, e.g., leprosy control, child survival and safe motherhood, national immunization programs, as well as AIDS control. Encouraging governments in developing countries to request for grants and loans from other sources such as external bank, bilateral and multilateral agency, that is the World Bank, the Rockefeller's foundations, in developed countries to influence concerned agencies to provide grants and loans for the strategy. Example, various religious organizations. Presentation of the government's a master plan which outline the use of all financial and material resources including direct and indirect financing, e.g., local community resources in terms of available manpower, material and money, individual payment for service, and the use of external loans and grants. International action and the role of WHO. To mobilize financial resources, WHO actions will consist of the following: ensure the exchange of information on alternative ways of financing health system, estimate the order of magnitude of financial needs for the strategy, promotion and development of methodology for and support cost, benefit and cost effectiveness studies on health systems and technology, strengthening developing countries' capacity on request to prepare proposal for funding from external resources for health, use its mechanisms to identify needs and facilitate mobilization of funds as well as transfer between countries, establishment and coordination of activities of global health for all, resources group representation countries, intergovernmental, bilateral and multilateral agency and foundations, as well as non-governmental organizations working together to rationalize the transfer of resources for health for all and to mobilize additional funds if necessary. Monitoring and evaluation. In order to know the program in implementation of any strategy and to evaluate the effectiveness in improving the health status of the people, it is essential to set up a process of monitoring and evaluation. Success of any program depends on constant monitoring of its different activities by guidance of an inbuilt predetermined system of monitoring and evaluation right at the stage of its inception. Monitoring process as well as evaluation are complementary to each other to observe and assess the process of planned program. What is monitoring as well as importance of monitoring? To define monitoring is simply day-to-day follow-up of activities during the implementation stage to ensure that things are proceeding as planned and are on schedule. That is, what you schedule and plan, you want to see that the planning are going on, the activities is running the way it should. It is a continuous process of observing, recording, and reporting on the activities of the organization and projects. Monitoring thus consists of keeping track of the course of activities and identifying deviation as well as taking corrective action if deviation occurred. We want to compare monitoring and surveillance. Are there difference between surveillance and monitoring? Of course, there is slightly difference between monitoring and surveillance, and we are going to see the difference between surveillance and monitoring. We see that monitoring is similar to that of surveillance, but in public health practice. During the past 25 years, they have taken on a rather specific, that is, surveillance has taken a specific practice. Monitoring, again, can be uh, explained or defined as the performance and analysis of routine measurements aimed at detecting changes in the environment or health status of population. For example, monitoring of an air pollution, water quality, growth and nutritional status of children, and so on and so forth. So we see that you can monitor all these examples that we have given. It also refers to, that is, monitoring also refers to the measurement of performance of an ongoing health services or health professionals, or of the extent to which patients comply with or adhere to advice from professionals, from health professionals. In management, monitoring refers to the continuous overseeing of activities to ensure that they are proceeding according to plan. It keeps track of performance of health staff, utilization of supplies and equipment, and the money spent in relation to the resources available, so that if anything goes wrong, immediately corrective measure can be taken. Surveillance. Surveillance, on the other hand, is defined in many ways. According to one interpretation, it means to watch over with great attention and authority of the minute details in a situation. Surveillance is also a continuous scrutiny of the factors that determined the occurrence and distribution of disease and other conditions of ill health. Surveillance program can assume any character and dimension. Thus, we have epidemiological surveillance, demographic surveillance, as well as nutritional surveillance. What are the objectives of surveillance? One, to provide information about new and changing trends in health status of a population. For example, morbidity, mortality, nutritional status, or other indicators of environmental hazards. To provide feedback which may be expected to modify the policy and the system itself and lead to redefinition of objectives. To provide timely warning of public health disasters so that interventions can be mobilized. Those are the three objectives of surveillance. According to the above definition, monitoring becomes one specific and essential part of the broader concept embraced by surveillance. Monitoring requires careful planning and the use of standardized procedures and methods of data collection, but can then be carried out over extended periods of time by technicians and automated instrumentation. Surveillance, in contrast, requires professional analysis and sophisticated judgment of data, leading to recommendations for control activities. That is what we are going to cover so far on Unit 5. And by God's grace, the next meeting we have will be looking at the evaluation of health services. Thank you for watching your PowerPoint instructional video. See you in the live class session. God bless.